Okay, let's go ahead and bring it back. This should have been pretty easy, right? So you probably thought of like 10 things before I even told you to break into groups. Somebody that took the first question, where are we at? A group we haven't heard from. A group we haven't heard from. Yes, coming your way.
We just talked about like benzos, particularly.
Okay, benzodiazepine. Great. Okay.
Because they're extremely sedating or can be.
Okay. Good. So yeah, benzodiazepines are a really good one. They're kind of relevant to the discussion we were having earlier, right? Other thing that's kind of unique about benzos is they're suppress respiratory drive, right? Okay, good. What else? Any other drug classes y'all came up with for the first question? What was it?
We were thinking about hydroxyzine and hydrazine.
Yeah, good. Okay, so hydralazine being for blood pressure, hydroxyzine being for allergic events. So, yeah, depending on where their heart rate is at the time, you're going to push it in the opposite direction you think it's going to happen. So, yeah, so those are pretty prone to error. So we call those sound-alikes, right? So, or a look-alike, depending on what the product looks like as well. They're both 1 milliliter vials if you're looking at the injection. Of course, the benzos there. So why would benzodiazepine be prone to error? Sorry, looked wrong person. What makes that prone to error, do you think?
Just because the accessibility of them, people aren't
Yeah.
much suppression involved.
Yeah, so the doses are kind of dependent, right? So every person is different. You know, whenever we look at sedating agents, when we look at opioids, when we look at other things, every person is very different. And so you have to have that in mind, that your window of therapeutic to toxic is very, very tiny, and it's going to vary from patient to patient. Okay, how about the second question? Consequences of the error. We already mentioned benzos. Opioids is too easy. What else we got? Insulin. Right, insulin's a great one. Actually, it fits in the first two categories, right? So insulin is very prone to error because there's how many ever different kinds. There's even different concentrations. Don't know if you knew. There's a 500 unit per milliliter regular insulin that's out there in the market. It terrifies all of us, right? Okay. How about relevant human factors? So what about human factors as far as looking at drugs that we want to be concerned with? Do y'all know what I mean by that? Yeah, there could be the patient factors, right? But what about like human factors as far as me just engaging with something? So, what classes of drugs might be more prone to that human component? I don't know how to say it without giving it away. I'm sorry. Yeah, there you go. Schedule drug, right? So abusable drugs, right? Okay, great. All right, so let's go back to our question. So we were talking about this case. So what I'd like to do, we're going to close this out. I need a very brave volunteer that wasn't one of the ones that was taking notes earlier. And then after that, we can leave. Did that motivate? We got a volunteer. You weren't taking notes, correct? You were not one of the ones taking notes. Okay. I'd like you to tell me everything you remember about the case I gave you at the beginning. Give it a good try. I realize it's a hard one.
61-kilogram female.
Somebody's been writing soap notes. No. Come on. Everything you remember. Everything you recall. Doesn't have to be specific. Don't recite me word for word. Did you take notes? No. You can pass it.
Yeah.
That's all right. Say what you remember and then we'll pass it to somebody else.
She was receiving IR procedure for back pain.
Okay. No, keep going with whatever you remember, and then once you kind of hit a wall, skip.
She received multiple doses of fentanyl and Versed.
Okay, good. Keep going. Let's make a path. Not even making eye contact.
No. Next.
Keep going, guys. Keep on. I remember she died. Okay. Well, that's good. That's an important piece of information.
I take notes.
Chicken. Just pass it back to somebody else then.
I keep hearing voices that tell me that her name is Jennifer Smith. There you go.
She was a 56-year-old female who was on a boat and hit a big bump, and she ended up having back pain as a result. Yeah.
She had a history of depression but wasn't on opioid therapy. She was naive, but she was still given those large doses.
Okay. So, let me remember what I was going to say. Okay, so, okay. I don't know.
No, not good stuff.
Oh, okay. They checked her vitals 3 times. I don't remember the 3 times. Anyway, they checked him 3 times. Her respiratory rate.
Okay. Separated by about 2 minutes. Good memory. Very good. Okay. What's my point? If you don't document it, your likelihood of remembering is pretty poor, right? There's a couple of points. Okay, so first, one, recorders. Just somebody that's been kind of following along, kind of ticking the boxes. I'm sure somebody was. There's got to be that personality in the room somewhere. And so somebody that was ticking the boxes. Just guesstimate. What percentage of the information was captured? 100. Lies. Lies. Would you say 50%? With everybody participating. 60 or 65? We got a bolt. Do I hear 70? Do I hear 70? No. Okay. So how much time has passed since I gave you that case? Not even an hour and a half. About hour 15, right? Hour 15. What do you think happens whenever, let's say we have a case that happens, we all work at the same hospital, we have an event, and we want to debrief that event. When do you think that debrief should happen? Immediately after. Yeah. We usually don't do debriefs on events more than 24 hours, and certainly not more than 72 hours, because then we start re-remembering things. How many of you had in pieces of information like, I think that's right, but I'm not sure, right? So that's kind of my point. There's a few points here. So one is that we want to be sure and debrief an event immediately after it happens, because even between 100 of you, you couldn't get much more than 65% of the case that was delivered less than 2 hours ago. How do we expect a healthcare worker that's treating up to 16 patients a day to remember one of those patients in one moment in time? Good point? All right. Hopefully that gives you something you can work with in practice. As I mentioned, the next session is recorded. We'll actually bring back the case. So if you took notes on the case, please go ahead and save those, but don't share them. All right. So we've refreshed our memories once, right? So the next time we'll talk will be in a week. So let's see how much we remember then. Don't study that. I know you have more important things to study. Okay, so try and keep it honest. All right. So if do we have any questions or any comments or anything before we go? For the exam. No, no, I'm not going to test you on your memory on the case. No, I added that at the last minute. I actually thought about that this morning. I was like, I just finished this case. I was like, it hits all the points. So let's use that to frame it. And I feel, hopefully, was that helpful to have that real life case? Good. That was the idea. All right, cool. So we are good for the day if there's no other questions. And y'all can enjoy all this lovely food up here.